Welcome, everybody, to IsisParenting's Breastfeeding and Pumping Chat and Learn. My name is Nancy Holtzman, and I'm a mom and baby nurse educator and a board-certified lactation consultant. I've been working with expecting and new families in the greater Boston area for the past 22 years or so. And with me today in beautiful, scenic, sunny Needham, Massachusetts, is my partner in crime, Cindy. She is our community manager and is managing the community in the general chit-chat room right now. So thank you, Cindy, for all that you do and helping me with my slides and so on as well. So today, as I mentioned, we're going to talk about babies, breastfeeding, and bottles, and how you can, to the very best of your abilities, make it all work together. Because at least in the population and the demographic I work with most, moms are getting ready to go back to work, either part-time or full-time, or may need to occasionally be away from their babies, sometimes wanting to leave for an evening away or needing to do appointments or what have you. So it's a very common concern that moms want to make sure the baby can comfortably take a bottle. So a lot of times in these webinars, I focus on a lot of breastfeeding issues, concerns, and challenges. But today, I'm going to operate under the assumption, which is truly an awfully huge assumption, that in relation to this topic, breastfeeding is going well. In other words, breastfeeding is going well enough that the concern is introducing the bottle to the baby and helping to ensure that the baby will take the bottle comfortably. And then making sure that the baby will take the bottle comfortably and yet still go back to the breast easily and be able to go back and forth. So that's really the focus of what we're talking about today, because I talk about these things an awful lot. I talk about the many paths to breastfeeding and how it can be quite a bumpy and long winding road for many people to get to direct breastfeeding. Whether a baby comes early or is ill or has oral anatomy issues like you see here with a tight frenulum or a tongue tie in the bottom corner, or a baby who's having difficulty but that's not really the focus that we're covering today. Today, I'm talking about when breastfeeding has been going well and mom is ready to introduce the bottle to the baby. What is the best practices for that? What are some considerations and things to think about? And then for those that are getting ready to go back to work, how can you hopefully ensure that the baby is getting adequate nutrition comfortably, making it easier on the baby and easier on the caregiver while you're away, and that you're keeping up with the baby's demands and so on. I mean, we all want the baby to be happy and healthy and not struggle and not have feeding be a stressful scenario in the daycare environment. And we want your caregiver to say, to you like, oh, it's okay, a lot of babies don't take the bottle, you can cut feed, or oh, well, he'll reverse cycle. Reverse cycling, for people that aren't familiar with that expression, means that the baby will begin to shift their metabolic intake and take in a lot more milk at night, for example, while breastfeeding and bed sharing, versus eating during the day. And it sounds good on paper, and it's a, can be a short-term easing into the situation solution. But for a lot of moms that have, busy, stressful, important jobs, well, I shouldn't say important jobs, busy, stressful jobs, moms need to be on their toes during the day, and everybody needs a restful sleep at night. So it may not be sustainable or feasible to have a baby up 8 times at night, nursing all night long so that they're sleeping soundly during daycare. I was thinking about this earlier, and one thing I was thinking about is that my son, who's a teenager, has had multiple surgeries in his life, maybe 12 surgeries. And I was just thinking about the fact that I sincerely hope that everybody from the surgeon to the operating nurses to the anesthesiologists to the OR techs who clean the ORs in between, I certainly hope that every one of them got a decent night's sleep the night before. And I hope that they weren't up every 2 hours with their baby, because to me, it's important that they got a good night's sleep. So I know for most of you, it's pretty important that you get a good night's sleep. So reverse cycle feeding may not be a long-term sustainable solution for a baby who's refusing a bottle and going into daycare with mom working full time. How do you go about it? So when at all possible, the baby the best way for a baby to ensure the flexibility, I shouldn't say ensure, but the best way that you can hope that your baby is going to have that flexibility to go back and forth between the breast and the bottle, let's hope, is to start off at the breast. So really, babies learn about breastfeeding by breastfeeding, and the more experience and exposure they get to breastfeeding, the better at it they get, and it is very much like a complicated dance. So both mom and baby are learning and practicing together, and before too long, hopefully, they begin to get in sync and get in step, and stepping on each other's toes. The toes stop hurting so much, and it actually is very comfortable and enjoyable, and you can do it without even thinking about it too much. You just ease right into it. And so during the first couple of weeks, focus on getting breastfeeding up and running and smooth. And for some people, that's easier than others, but that really hopefully is the goal of the first few weeks. Just breastfeeding. There's enough. There's enough in your life to keep you busy. Now, if you're interested and eager and in a hurry to introduce the bottle, because of course, any of the other educators that might be listening in today know that one of the first questions we often get in a prenatal breastfeeding class is, when can I pump and give the bottle? When can the baby take a bottle? So of course, there is an answer to that, and the answer varies because some babies will get the bottles when they're 2 and 3 days old, even before they get the breast, if there are complications going on with either mom, baby, or breastfeeding. But again, in the perfect world, which it would be nice if we all lived in, but don't, but in the perfect world, let's just focus on having the baby at the breast for the first few weeks, 2 weeks. And that way, breastfeeding is well established and everybody's getting the hang of it. Then, if you're interested and eager in introducing the bottle on the earlier side, I would begin dabbling with pumping around weeks 2 and 3 and introduce the bottle around week 3. If you're not in a huge rush, then I would put it off an additional week, and I would say dabble with pumping around weeks 3 and 4 and introduce the bottle sometime around week 4. And the reason for this is because when babies are very young, during their first month or so, sucking still is a reflex, and it's a reflexive behavior. Typically, if you put your nipple in the baby's mouth, a pacifier in the baby's mouth, your finger in the baby's mouth, babies generally do or not to suck. So when you introduce the bottle sometime between weeks 3 to 6, generally babies take the bottle without too much fuss. When you wait quite a bit later, it sometimes is more challenging. Now, in general, babies like to suck, and if there's milk coming out, that could be an added bonus. But I would say that one of the reasons why some babies have difficulty bottle feeding is if it is introduced around week 8 or 10 or 12, they may or may not take to it easily or readily. When you do begin to introduce the bottle, my general recommendation is to give the bottle, one bottle of expressed breast milk, and just start with a very small amount. Maybe if it's a 3 or 4 week old baby, I would maybe just put 1 ounce in the bottle the first time, and then if the baby drinks that, great, that's a success, and then you can finish that feeding right at the breast. And then the second time, maybe you would put 2 ounces in the bottle, and you can keep it to 2 ounces while your baby is quite young. But I would generally recommend giving your baby a bottle, and again, by a bottle, I can say maybe 2 ounces of expressed milk, once a day until it seems to be going smoothly or reasonably smoothly. And that might be 3 times. So you may give the bottle Monday, Tuesday, Wednesday, and the baby takes it relatively easily Monday, Tuesday, Wednesday, fine. It may take a little bit longer, but generally, if your baby is a month or so old, they'll generally take it fairly readily. And then you can switch to giving the bottle every other day or so. So again, this is not set in stone, but in general, I do recommend once you introduce the bottle, continue offering the bottle feeding experience roughly every other day without a long break in between. Sometimes people assume that because the baby took the bottle easily, maybe they were severely jaundiced and the pediatrician, said the baby must have expressed milk or must have formula, and the baby took several bottles during their first week or two. And then 3 or 4 weeks or 5 weeks go by, and parents assume that because the baby took the bottle earlier, the baby knows how to take the bottle and they're all set already. But it doesn't always work that way. And in fact, another issue that can come up is what I call a bottle feeding vacation. So sometimes babies will be taking the bottle fairly regularly, say 2 or 3 bottles a week, without for example. So if the baby suddenly goes 10, 7 days or 10 days with no bottle experience, when you bring it back out, maybe it will go very smoothly and maybe not. So I don't have a guarantee. I also don't have a guarantee to say that if you give give your baby a bottle every other day, that they will never decide all of a sudden to have a hard time with it, because sometimes, it's rare, but sometimes that happens too. That even though you're giving the bottle regularly, for no discernible reason, all of a sudden the baby begins to refuse. But that is far less common than a baby who has taken the bottle and then you go a long period of time without offering one, and then when you reintroduce it, it does not go well. So my recommendation is sometime around week 3 or 4 to begin dabbling in your pump. Pump each morning after you breastfeed. You can add a second pumping session later in the day after breastfeeding if initially you're expressing very small volumes of milk. You see that I'm talking about using a high quality double automatic breast pump and a hands-free pumping bra, because especially if you have a baby a month old at home, it's very difficult to figure out when the heck can you pump when the baby wants to eat all the time and erratically. So the answer is the baby comes first and you pump after the baby feeds. And instead of trying to time it for waiting midway between 2 feedings, just pump right after the baby feeds, and use your hands-free bustier so you can be pumping both breasts, hands-free and hands-on. Hands-on means hands on your baby so that you can entertain and keep your baby content, and hands on your breasts, because by doing massage and compression while you're pumping, you'll pump more milk and higher fat milk. Then you take the milk that you're expressing and you can alternate between putting it in the fridge and putting it in the freezer. So an example, Monday, Wednesday, Friday, the milk goes in the refrigerator, and that's the milk that you'll be using for bottle feeding. And the other 4 days of the week, the milk goes in the back of the freezer, and that's the milk that you're starting to build up for your freezer stash for emergency scenarios when you go back to for emergencies. Okay. So what do you use and what do you pick? Because certainly when you look at the shelves in the stores, there are so many different types of bottles and bottle feeding paraphernalia, and there's wide neck and narrow neck and orthodontic and tilted bottles and vented bottles, and how do you know what to use? So let's just bring it down to the basics for now. The bottle that's in the center, I'm trying to use that to represent what is called a standard bottle neck. Okay, and a standard bottle neck means that the collar of the bottle, the little plastic round part that the nipple pulls through, that's a standard thread, and it's a standard size, and those can go interchangeably from one brand of bottle to another and one brand of bottle nipple to another. So if it is a standard bottle neck, then you can use an even flow bottle with a Gerber nipple and a Medela collar, because they all fit together. Contrary to that, you see I have a picture of I think it's a Dr. Brown's set on the upper left corner. And these are what I call bottle feeding systems, meaning they're a system unto themselves and they are not interchangeable with other brands and other sizes, because the neck collars are different, the threads won't screw on tightly, and one brand's bottle nipple may not work with another collar or another type of bottle. So figure out if you're using a system or if you're using, kind of a standard interchangeable collection of bits and pieces. The other thing I just want to point out is the difference between talking about what bottle you're using versus what nipple you're using. I use the term nipple. The official word is teat, which is kind of a funny word to say, I think. But the teat of the nipple is the plastic nipple, because obviously a real nipple is mom's nipple. But for simplicity's sake, I'm going to call it a nipple here. The nipple is a lot more important than the bottle itself. Okay, so it can be pink or blue or yellow. It can be straight or bent. It can be big or little. That doesn't generally have a big impact into the baby's bottle feeding experience and how the milk is flowing. And then finally, I just want to point out an important piece of equipment is your bottle brush. And of course, I talk about this a lot in the pump talk class in terms of keeping things clean, but you do need to have a bottle brush that's just for your baby's bottles and nipples, pacifiers, and your pump pieces. So that's going to be important to keep things clean. If only it were this easy to feed your baby and to fake your baby out. But babies are just too smart. So you can't just take your breasts off and put them in the fridge and try, as companies might, to create things that they think will appeal to the parent, and so they'll purchase it, or appeal to the baby so the baby will take it. It's just not as easy as people make it seem. So a lot of bottle feeding companies will make some marketing claims, and a lot of times they'll say, hey, it looks and feels just like mom. Well, some may look or feel a little more like some mom than another, perhaps. The bottle system on the left is called an Adiri, and in the old days, it used to be called the breast bottle, and they made it a little better in that it doesn't leak as much anymore, but it used to leak a lot. The interesting thing about this one is that the whole dome at the top is all like soft and poochy, it has like a vinyl-y feel to it, so it's very flexible, and if it presses up against the baby's face, it has a lot more give to it. It's not particularly firm. The one in the middle is called a Tommy Tippy. That's currently quite popular amongst moms. And the nipple itself has some ridges to it that supposedly feel familiar to the ridges on the areola, if your areola is a piece of plastic. And then finally, there's another one here on the right, and you can see, gosh, they colored it so it looks like, a certain demographic of female, I suppose. My skin doesn't look exactly like that color, and it's tilted, and it's round, and it looks breast-like, but that's quite an extendable nipple. And I'll tell you, as a lactation consultant and nurse who's probably seen, I don't know how many thousands of nipples in my time, I've seen some nipples that look like an M&M glued to a beach ball. I've seen some nipples that look like a pinky finger tacked on to a breast. I've seen some nipples that are the size and thickness of a quarter. And I've seen lots of nipples that just don't protrude a whole lot. And so I think it's really distressing for a lot of moms to look at these things and think, gosh, is that what I'm supposed to look like? Because no, you're not. Here's something that really does look and feel like mom. Really. You're not going to fake out your baby. And the goal is not necessarily to fake out your baby. The goal is to try to figure out a bottle portrayed at the breast, because you don't drink from a breast the way you drink from a bottle. And your babies are good at breastfeeding now, so we don't want to teach them bad habits at a bottle that then they'll translate to the breast. Look at this little smiling breastfeeding baby in the corner here. When you come home from work at the end of a day and your baby's been in daycare or with a caregiver and has had 3.5 bottles, they know the difference between you and cuddling and nurturing and nursing and some caring person holding them and giving them a bottle. There's a difference. So here's some that supposedly work like mom. I put some notes here just to remember to talk to you a little bit about. So these first nipples on the left are called Nook nipples, and they're orthodontic nipples, and they look kind of weird. They're the end is tilted a little bit. The interesting thing about those is they look odd on the outside, but they're kind of designed to fit inside the baby's mouth the way a baby does pull breast tissue into the mouth and then compress the breast tissue against the roof of the mouth. So even though that's not what your nipple and breast look like outside the baby's mouth, it kind of a little bit is more of what it looks like inside. Your nipple, I think y'all know, does not stay cylindrical in the baby's mouth. The other thing I just want to mention is the difference between latex nipples and silicone nipples. The latex nipples are softer, but they do break down a little sooner, and they get a little bit sticky and tacky, and they also may tear, or the holes may open a little bit. So I'm not saying they need to be replaced every few weeks, but the difference between the latex nipples, which are the tan ones, and these clear ones, because that's another orthodontic nipple, same type of nipple there. The silicone ones they last longer, but they're going to feel firmer and stiffer. And so, some babies, even just switching from one to the other, whether it's a latex or a silicone, sometimes changes the baby's feeding experience, makes it a little easier for them. The nipple I'm putting on the right-hand side here, I don't even know where I got that one, but geez, that is just one long nipple there. And that can cause a problem for some babies. I'm going to call that the super stimulus nipple here. And that's another reason why I might encourage somebody to think twice about introducing a pacifier during a baby's first couple of weeks while they're learning to breastfeed, particularly if that mom doesn't have really, really long, firm nipples. If a mom has fairly short nipples or tight, taut areola skin, or has flatter nipples or inverted nipples, introducing a pacifier can cause some breastfeeding issues, because then when the baby comes to the breast, they're not feeling something long and firm and hard sticking into their mouth that basically sits in their mouth and says, here, this is what you're supposed to suck onto. When they come to the breast, they've got to open their mouth wide and draw in tissue and basically, make a little bit of a mound of flesh to nurse on. And that's fine. That's how it's supposed to work. So sticking something that's really long and firm and very present in your baby's mouth when that's not what your anatomy presents can be an issue until your baby clearly learns how to breastfeed well. So it doesn't mean it's going to be an issue long term, but I certainly would wait until the breastfeeding thing is up and running so that the baby knows how to latch easily before you start sticking other firm things in the baby's mouth, particularly if you have short or flat or inverted nipples. Another reason that these bottle nipples don't necessarily work like mom is because in almost all bottles, the milk drips or flows. And babies can easily make the milk drip or flow by wiggling their tongue or moving their gums or their jaws. Almost any little movement will help the milk flow. They don't necessarily have to suck. They don't have to suck hard. They don't have to apply vacuum and compression. They can just sit and wait, and the milk may drip, or they can just kind of nudge the nipple a little bit and the milk will flow. Another reason why certain types of bottle nipples may be a problem is some babies have a little bit of oral sensitivity, and that may be called oral defensiveness. I could do a whole class just on this. But if your baby seems aversive to having something stuck in their mouth, by all means, don't stick something in their mouth. Wait until you're invited in, especially if it's a very young baby. You can take advantage of the rooting reflex. Use the bottle nipple or your finger to stroke their cheek, to stroke their upper lip, see if they open the mouth. If you're allowed in with the bottle nipple, aim for the roof of the mouth so that you're not pushing against the tongue. You're going over the tongue, and the tongue should be under the bottle nipple, cupping it and pressing it to the roof of the mouth. So aim for the roof of the mouth, avoid pressing into the tongue, and don't reinforce a negative association. If the baby is arching and fighting and crying and red-faced, continuing to push that bottle into the baby's mouth is only going to distress the baby longer and create perhaps a negative association with the bottle. So let's kind of diffuse the situation before we get to that point. How does mom work? Well, again, here's a little visual graphic of a baby opening their mouth wide, using vacuum or suction to draw the nipple and areolar tissue deeply into the mouth, and then using the tongue and the jaw to press the areolar tissue against the roof of the mouth while using suction to help move the milk down and out. Okay, so it's a very complex um, mechanism, and babies have been practicing for a long time. In utero, they practice sucking, and when a baby is eating, what they have to work on is suck, swallow, breathe, suck, swallow, breathe. I think I might come back to this slide in just a few minutes because I want to talk a little bit more about bottles that have a little bit more technology going on with them. So there's two interesting bottles here. On the left, that one's called the Breast Flow, and then on the right is the Medeala Calma. On the outside, they look kind of similar, meaning there's kind of a nipple within a nipple and so on. The difference between the two of them, as I understand it, is the fact that the Breast Flow does use vacuum and compression to move the milk, but the bulb at the top of the nipple, so you've got a nipple within a nipple, but you can fill that bulb, the baby can use suction and compression to fill that bulb with milk, and then could just use compression in their mouth, just biting down to get the milk to come out into their mouth. Whereas in the Medeala Calma, the baby needs to actually apply vacuum each time to get milk. So there's no laziness or hanging out going on. To get milk, they need to suck and not just hang out, wait, or compress. Okay. Here's something pretty important to think about. What's going on with the baby's mouth when they're taking a bottle? Their jaw, their tongue, their lips. It may not matter a whole lot. If your baby has no issue going back and forth between the two, then you may not need to be overly concerned with these types of questions. But if you find that breastfeeding was going okay, and then you started introducing bottles, and then the baby begins to bite at the breast or clamp down at the breast, or you're starting to get sore at the breast because they're not taking as deep a latch and they're just sucking on the nipple, look at the bottle feeding. Look and see what's going on as the baby eats the bottle, because they're learning new feeding behaviors at the bottle, and we don't want them to translate some of those behaviors back to the breast. So I think those of you that have been breastfeeding and know a little bit about breastfeeding know that the things we like to see when babies are breastfeeding are kind of the opposites of what we're talking about here. So a very tight or pursed lip, when the lips are tight together like a kiss around the bottle nipple, with the jaw is not dropped low. The baby biting or chewing the nipple, moving it around in their mouth and chomping on it, especially like a 4-month-old who's starting to do some teething, and then clamping to control the flow. So some bottles will flow quickly, and the baby can learn to control the flow by using their gums to bite down. Yeah, let's not do that at the breast. So some better stuff is going on here. In the picture on the left, somebody did a nice job eliciting that baby's rooting reflex or asking to be invited in. The baby is opening their mouth, and you can see that the bottle nipple is maybe had touched the top of the baby's lip, and the baby opened into a nice gape. And I like to see that instead of chewing their way on the bottle, because let me tell you, I work with a lot of moms who are sore because they left the baby, or the baby has learned how to chew their way onto the breast or slurp their way off the and the lips flanged out. I like a bottle nipple, a teat that has a slightly wider base. And some people, it's not always what the bottle nipple looks like, but it's how the bottle is used. So make sure the caregiver actually understands how much of the bottle nipple should be in the baby's mouth. Because you could, if that hand pulled back a little bit, the baby could then just be sucking on the nipple. And then you would see what you saw in the previous slide. Okay, so this top picture on the right here, it could theoretically be the exact same type of a bottle nipple. It's just how it's positioned in the baby's mouth and how you're teaching the baby what they're expecting to feel when they feed. Okay. Now, this is a fairly complex slide. flow rate really matters. I personally think flow rate matters sometimes even more than the nipple shape and so on. So a lot of people will say nipple confusion, does nipple confusion exist and so on. I think a lot of nipple confusion actually is a flow rate preference, and there are a lot of implications. It can be a bigger story. So flow rate preference. So obviously here you see a fire hose, a waterfall, a drippy bottle, and a couple things. When a baby is drinking from a bottle, they come to the bottle, they make a couple of tentative sucks, or they move their mouth a little bit, whatever happens, their mouth, basically the milk comes, and it comes right away. And if it comes fast and it comes easy, then the baby is getting a lot of milk very quickly. And then when mama comes home and puts the baby to the breast, this may be what you see. A baby who's screaming at the breast saying, hey, I've given 3 or 4 tentative sucks and there's nothing coming on here. Where's the milk? Okay, so the bottle teaches the baby that the milk is there instantly. Not only that, but the milk is there instantly and sometimes in a very high volume. And the baby begins to say, well, why should I work for my food? I'm just going to sit here and scream at the breast and freak you out and make you worry that your supply is low and I'm ravenous. So maybe you'll go into that bag that you stuck in the closet that the nice ladies at the hospital gave you and pull out a little bottle of formula. So then you give the baby the bottle, and of course they drink it right away. And then mom begins to think the baby prefers the bottle over me, or I must not have enough milk, or whatever it is, you get into this downward spiral. And it is a downward spiral because the more anxious you are with the baby crying at the breast, and the more then you turn and reach for the bottle as the solution, if you are not doing other things to increase your milk production at the same time, it truly is a downward spiral, because as your supply begins to drop a little bit, it makes the baby less and less likely and less willing to put in any effort at the breast. So when the milk flows readily, quickly, and easily at the bottle, and they have to work and wait a little bit at the breast, and then add to that, if your milk supply begins to become more marginal because the baby is getting more bottles and you're not pumping or working to increase supply, that often becomes a downward spiral toward leaning to the bottle that moms may have not intended. Okay, so why is slower better? There's a lot of reasons why you should consider joining the slow food movement when it comes to feeding your babies. A young baby, 30 minutes is not too long to take to drink a meal from the bottle. And a meal from the bottle, depending on the age of the baby and the size of the bottle feeding, if we're talking 2 or 4 ounces or so, I think 30 minutes really is in that ballpark. It does take time for the baby's brain to realize their belly's been fed. If the milk is flowing very quickly, babies can plow through an astronomical volume of milk in a very few minutes. So say 4 ounces of milk, well, I'll use a smaller. It's flat and is still frantic. Of course the caregiver is going to assume the baby's still hungry and reach for another couple of ounces of milk, and the baby will probably drink it. And that's how moms leave work the first day or two, proud that they expressed 10 or 12 or ounces of milk at work, only to pick up baby at daycare and hear the baby went through 20 ounces of milk. Talk about a heart attack, The early days of daycare are not a great indicator of what's going to happen longer term. So use a little leeway during the first few days. If the caregiver is reaching for the bottle early and often to use it as a soothing and settling tool, so be it. Soon they'll figure out rhythms and they'll get used to one another, and they'll have lots of other things to do together and ways to distract and soothe the baby that don't simply rely on the bottle. But in the short term, if the bottle does comfort the baby, it's okay, but yet another good reason to use the slow flow nipple. A slow flow nipple means the same 3 ounces of milk, instead of knocking it down in 8 minutes and seeming like they want more, if that same 3 ounces of milk took the baby 18 or 22 minutes to drink, that baby is probably going to seem a lot more relaxed and satisfied and settled after, because their brain realized their belly was fed because they had lots more time sucking. And suckling is really important to babies. You know, they have very high sucking needs. And in a daycare environment, feeding time is a really important time of one-on-one or two-to-one interaction. So you want to get the most bang for your buck that you can out of that 3 ounces of breast milk. So have it last 20 minutes instead of 10, and it'll be that much more satisfying. Now, the lunch tray down below was my representation of a reasonable sized, healthy-ish meal for you. And in fact, some of you at home or at work might be looking at that and wishing somebody would bring you a tray that looks like that right now. But you've got a sandwich and some fruits and veggies and a side dish and a drink and so on. It's a balanced, healthy meal. Now, if you ate that and finished it, would I assume that it wasn't enough and so next time I should give you much more? Or if you ate that and you were satisfied for a couple of hours, would I assume that it was the right amount? So it's okay for your baby to almost routinely finish their bottles. It doesn't necessarily mean that they should have had more or that next time you should be giving them more. If they drink a bottle and it keeps them happy and content for a couple of hours, it was probably the right volume of milk. Okay, so it doesn't always mean how much more can you fit in. And then my analogy there with the chocolate chip cookies is if you kept offering me more warm, delicious chocolate chip cookies, I would probably keep eating them. So just because the baby drank 3 ounces and then somebody got the brilliant idea to offer the baby another 3 ounces and the baby drank that too, does not mean that they necessarily needed the additional milk any more than it means that I need to eat 10 warm chocolate chip cookies instead of 2. Okay. Bottle feeding and paste feeding and responsive feeding. The baby should be fed in an upright position, the bottle almost horizontal, a lot of interaction, a lot of frequent pauses, and let it take time. Oh my goodness, the baby won't take a bottle. Okay, here's some of my secret tips. Keep them a secret now. No. Some babies, here's just a random bunch of things to try. Some babies that are reluctant to take the bottle will do better when you really heat the milk. So obviously you want to test it and make sure it's not too hot, but in general, I'm not too concerned about the temperature of milk. They can drink it lukewarm, room temperature, slightly cold. It doesn't really matter as long as you melt. Have it be quite warm and warm the nipple as well. And some babies seem to do better with that. If your baby is 3 or 6 weeks old and partner comes home from work and it's 7:30 and partner's exhausted and you're exhausted and the baby's crying and everybody's cranky and tense and that's when you're trying to give the bottle and it's not going well, stop. Evenings may not be the best time for everybody. Okay, maybe try in the morning. So 7:30 in the morning, if your baby is in a happier mood, most people seem a little bit more relaxed in the morning. The babies typically are happier in the morning. So maybe trying at a different time of day. Weekend mornings often work well. If your partner is up and out super early on the weekdays, then maybe you try it on a Saturday morning and a Sunday morning. One of my favorite tips for the baby that won't take a bottle is this kind of going back and forth between the breast and the bottle like you don't care. Now, a lot of times common recommendations are anybody but mom should give the bottle. Mom should never give the bottle. Mom shouldn't even be in the room. Mom shouldn't be in the house. She shouldn't be in the state. She should be out of the country. But you know what? In some situations, the baby and mom spend the most time together, are very comfortable together. The baby associates mom with feeding, and mom has ample opportunity numerous times a day in a low-stress fashion to work on bottle feeding. So what I suggest is take 2 ounces of milk, warm it, put it next to the chair where you sit and nurse. Let the baby nurse at the breast, get a little milk so they're not starving, they're relaxed, they're in that nice suck, swallow, breathe rhythm. Then at a pause, sit them up slightly and offer them the bottle. So you can try to do a bait and switch, or you can forget about that and just, burp them, sit them up, put them back on the breast, let them suck a little bit, take them off the breast, and give them the nipple, the bottle nipple. So just going back and forth between the two, like you're saying, you can have milk here, you can have milk here, it's all milk, it's all good. If they don't want the bottle, don't push it. Just put it right down and put them back on the breast. Let them nurse for another couple of minutes and then do the same thing again. Just alternate between letting them nurse for a few minutes and then gently offering the bottle. Remember, aim for the roof of the mouth, and if they don't want it, fine. Put it back down and nurse again. So try that a few times throughout the feeding, and if they don't take the bottle, then put it in the refrigerator and then take it out again 2 or 3 hours later and do the same thing all over again. Warm it up again and just put it next to the chair and just do the breastfeeding, offer the bottle, breastfeeding, offer the bottle. Don't let the baby get really distressed. Act like you could care less either way. You can try that 3 times throughout the day, and then whatever's left in the bottle, by the end there, you're going to have to toss because it's been in and out of the baby's mouth a million times. And they may have drank a little bit of it here and there, but you can, off the record, you can continue to use that bottle several times within a short, like an 8-hour window, and then you're going to have to toss that milk. Okay, other tricks and tips that can work well. Anybody happen to know who the lady and the baby are down there? I'll go look at the chat and see if anybody got it at the end. That position, sitting up against mom's chest, facing out, or dad's chest, partner's chest, caregiver's chest, sitting up, facing out with the bottle coming in as you walk around. That is a good distraction movement position to offer a bottle to a reluctant baby. If your baby actually does latch on and start drinking from the bottle, sometimes using rhythmic movement and distraction will keep them sucking before they realize it. Okay, and then the picture on the bottom right corner is a baby awake in a car seat, and this is an odd suggestion but works for some people. I call it the disembodied arm. Okay, so for this one, you're going to sit behind the baby with your arm coming around the car seat, the disembodied arm with the bottle coming in, and use some distraction for the baby. I'm not going to say put them in front of the television. I'm just going to say use some kind of distraction for the baby and sit behind them and offer the bottle using the disembodied arm. Now, these little tricks and tips doesn't mean that you're always going to have to feed the bottle this way, but let's just go, stage by stage. The first stage is to let the bottle go into the baby's mouth. The second stage is to have them do a little bit of suck, swallow, breathe. Maybe they drink half an ounce. That's a great success. Next time, so slowly you'll be able to transition to a more, typical bottle feeding experience, but just do it step by step initially. Here's some other suggestions. Again, there's that sitting up, facing out position, and movement and distraction is the way to go here. Again, I'm emphasizing the back and forth between the breast and the bottle because I have to say, out of all of my suggestions, that's often the one that ends up working the best. Being outside or in some kind of interesting environment can work well. Again, the baby sitting up, facing out can work well. That's just, I guess, a little review, because I like the pictures and I just got to use as many pictures as I could. And here's just some other things to think about. This happens rarely, but it does happen, where the baby won't take the bottles, and then finally somebody realizes that the breast milk is spoiled. Okay, so the milk should look and smell fresh, and some babies initially, if you're really having difficulty, I would try using freshly expressed milk. You should be able to store your milk in the freezer for as long as 5 to 8 days, perhaps longer. But some moms have high lipase, and that becomes an issue. I won't spend time on that right now, but the milk should look and smell fresh and okay. And some babies who are very persnickety notice the difference between milk that's been in the freezer and milk that's fresh, and that's not going to be a long-term issue like, oh, I'll never be able to use my freezer stash. But if your baby is persnickety about the bottle, let's first just try using freshly expressed milk and see if that helps a little bit. Other things to think about if the baby is older, and by older I mean maybe 5.5, 6 months up, is the baby interested in solid foods? Because not that solid foods are a substitution for breast milk or for breastfeeding or bottle feeding, but if you're desperate for ideas, you can use a whole grain rice cereal or a whole grain oatmeal baby cereal with the breast milk, and sometimes the babies are interested in taking that, and at least it makes the caregiver or the grandparent feel like there's something they can feed the baby. And another thing, I know this is sort of an out of the box suggestion, but sometimes this works again well for older babies, which would be use 1 ounce of white grape juice and 1 ounce of water in the bottle, and see if the baby is more interested in playing with the bottle or the sippy cup when it has juice instead of breast milk in it. Just something to think about. My analogy with the boy and the Doberman, that's not a Doberman, but I usually say the boy and the Doberman, is that imagine you've got a little kid who can ride his bike without training wheels. He just doesn't like to do it, but his dad is really pushing him. So every day dad gets home from work and makes him show him how he can pedal to the end of the driveway, around the mailbox, and back up. And the kid kind of dutifully, reluctantly does it. So he can barely do it. He can do it, but he just doesn't like to. But the day that there's a wild dog chasing him down the street, he can get on that bike and he can pedal fast all the way down the road because he knows how to do it. Now that's a very different scenario than this kid who's been presented with a bike for the first time and has never figured out how to ride it. And when the dog is coming bearing down the road at him, the kid is in trouble because just because he's desperate doesn't mean he's going to miraculously know how to do it. So that's the difference between a baby who can take there is a difference, and starving the baby out is not going to solve that issue. What about sippy cups and cup feeding? Another very common suggestion. Oh, your 3-month-old won't take the bottle. Well, just use a sippy cup. Easier said than done. It is possible. It works better for older babies. The question really to think about is your caregiver, is the grandparent, the daycare center, is this sustainable? Because you can cup feed even tiny preemies. It's very time consuming. It can be difficult. If it's not done right, it can be problematic. And it takes a long time to get a little bit of milk in there. If you do want to try a sippy cup instead, use a soft spout. And I like these ones down at the bottom here, which are the take and toss 4-ounce cups, because they don't weigh a lot and you can fill them 2/3 of the way up so that when the baby tilts them, the liquid is right there and there's no valve. So they don't have to suck real hard to get to the liquid. Here's just some funny pictures, and not so funny, that I found while getting pictures to do this slide deck. The nice thing about a bottle is that there should be another person on the other end of it and not a prop. Okay? Some of these are pretty bizarre. Just an interesting thought to think about. Usually I laugh at these pictures, but you know what? There are some babies that won't take a bottle but will take a pacifier. And there are these 2 products just that you could know about. One is called the Podi, and the other is called the Pacifeeder. They're 2 different companies, make these 2 different products. And I think you see what you're getting there. So if the baby, for whatever reason, does take a binky but will not take a bottle, this might be something that you could try. All right, wrap it all up with a bow. I'm going to run through quickly, and then I'm going to get to a few questions. Close your eyes so you don't see all the slides making you dizzy. I hope this was all helpful information. I think I was going to take some bullet points and put them on the end there, but I didn't get to it. Okay, so assuming that you are breastfeeding and your baby's going to be going to daycare or needs to take a bottle, that is the assumption we're going with here. You're expressing your milk and you want it to go smoothly. So you're going to be working on bottle feeding, first by starting with breastfeeding, and then around 2, 3, or 4 weeks, you can begin expressing some breast milk and introducing the bottle around that time. Continue giving a bottle, 1 or 2 ounces by bottle, once a day until it seems like the baby is kind of getting the hang of the bottle. And then you may switch to every other day or every 3rd day. But in general, I would recommend that the baby take with the bottle, most likely, is the bottle nipple shape and how their mouth is on the shape, and the flow rate. Babies are not faked out with what the bottle looks like. Most bottle claims are marketing claims. They don't work like a breast works. Don't push a big, thick, hard bottle nipple into the baby's mouth and create more problems. Consider using a bottle that encourages the baby to approach the bottle more like they might remove milk from the breast, and use vacuum and compression to get the milk out. And in particular, the Medela Calma bottle, they have to use suction to get the milk. If they just hold the nipple in their mouth, milk will not flow. So the research that they use to develop the mechanics of that bottle is the infant oral anatomy while drinking. So how the milk is removed from the breast using vacuum. By the way, that bottle, the Medela Calma bottle, is not designed to be a bottle that will work for a baby who's refusing bottles. It is designed to be used, introduced as the first bottle. So that's, I think, a key point, is that if your baby is 2 or 3 weeks old and you haven't yet introduced a bottle, that would be one to consider. It's not a good bottle to switch to if you've been having a lot of problems with bottle feeding in general. The baby may not automatically be like, oh, hey, this is just like breastfeeding. No, instead, that's a bottle that's kind of designed to help you hedge your bets on not learning bad behaviors at the bottle. So the behaviors learned on that nipple may be more apt to the behaviors the baby needs to continue at the breast to remove milk. Make sure your baby's mouth is not like this. You don't want the lips tight, the mouth closed, and chewing around on the nipple. You do want the mouth open wide, aim the nipple to the roof of the mouth, the jaw dropped, and the lips flanged out. Flow preference, slower is better. Allowing the baby to be fussy at the breast and follow up with a bottle, if you're not doing anything else to fix that situation, it's not a great situation to get yourself into. We, as IBCLCs and lactation consultants and so on, can usually help interrupt that downward spiral. But the longer it goes on, the more challenging it can be. Slower is better. Slow flow. Let the same 3 ounces of milk take 30 minutes, not 10. The baby will be more satisfied. Upright, not reclined feeding, because the milk will flow slower that way. Take frequent pauses for interaction, burping, spread it out so that not that you're pulling the bottle away and letting the baby cry, but removing the bottle for interaction so that it is an experience rather than a chow fest. Some tricks if the baby won't take the bottle: warm the milk, try a different time of day, preferably in the morning. Consider having mom offer back and forth between the breast and the bottle with no stress and no expectation. Try having the baby sitting up facing out with the bottle coming in. Try the disembodied arm, having the baby be behind the baby with the bottle coming from the front. We covered that. Check your milk, make sure the milk is fresh and delicious. Only for an older baby, you can consider doing a porridge or gruel with whole grain. You can consider trying diluted juice. This is the only time you'll hear me suggest juice. I am not a fan of juice for babies. Juice in an open cup, diluted half strength in an open cup after 1 year at the table, but this might be a reason to put an ounce of juice and an ounce of water in a bottle and see if you can work on the bottle feeding for a baby that's 5 months up. Sippy cups and open and cup feeding are feasible and possible, but generally not sustainable as a long-term solution. So work on the bottle feeding. Other alternatives, and there you have it. Okay, I think that took a while, so I'm going to answer a couple quick questions. And let's see, Cindy's given me a couple of suggestions to get to. Okay, we've got 3 different questions about teeth. So I'm going to talk about teeth, and maybe I'll take one more question, a question about weaning. Teeth. Okay, so in general, the usual suggestions for babies that are getting teeth Number one, the bottom teeth are usually a little less troublesome because when the baby is nursing, the tongue covers them. The top teeth are a little more troublesome because even when the baby is showing their very, very best breastfeeding behavior, those sharp little teeth do irritate your skin until you get used to it a little bit and until they dull down a little bit. Babies are most nippy as they're cutting teeth. They tend to go through phases of being nippy. It's not a joke, so you don't want to smile and treat it funny. It hurts like the dickens, but if you shriek or yelp or speak harshly to the baby or snap, what's the word, flick their cheek, like I once read somebody suggest online, all of those things can really startle or scare your baby, and not to scare you, but could lead to a nursing strike. Some nursing strikes do start that way, where a mom inadvertently shrieks from the baby biting or scares the baby at the breast to prevent the baby from biting. Don't recommend that. I do recommend pressing the baby's face deeply into your breast tissue. They will immediately respond by opening their mouth. Hurts, no biting. For an older baby, you can drive that message home by saying the same thing and then putting the baby down on the floor and walking away, and your baby will melt down. They really don't like that. But if you're going through a lot of biting episodes, that's a better technique than doing something negative at the breast. But it's time to teach your baby some manners. They're not doing it on purpose. They don't understand that it hurts you. And also, by that note, don't let them chew on your fingers. I would say starting around 5 months or so, don't let your baby teeth and chew on your fingers, because they even if they don't have teeth yet, because they don't understand why it's okay to bite and chew on that type of flesh, but not this other type of flesh. And they also don't understand why one day you let them bite on your fingers, and then the next day when they have teeth cutting through, you don't. So hand your baby a teether or something appropriate to chew on, but teach your baby that they may not chew on any flesh, your nose, your finger, anybody's friend's finger, and so on. You're really just distracting and modeling. They're not doing it maliciously, and you're not going to teach them or train them. But I also would just pay attention toward the end of a feeding when your baby is hanging out at the breast, because that's when most nipping occurs. Okay, and then last question for the day. Hi, Nancy. I'm wondering about weaning. My daughter is 8 months old. Last time we tried the bottle with her so she can take pumped milk, she refused it. She does take the sippy cup, though. Okay. So, yeah, you can offer the sippy cup if you're going to do a slow weaning approach. And I will say that here in the United States, when we talk about weaning, we're talking about stopping breastfeeding. Generally, in the United States, weaning means you will stop breastfeeding, whereas in other parts of the world, weaning simply means giving something other than breast milk. So a baby that's starting to eat solid foods, for example, is in the weaning process. So it's just a semantics thing. So I think what I would encourage you to do is to nurse as much as you're happy to nurse and your baby is happy to nurse. See what kinds of high quality solid foods your baby is interested in eating. Babies don't need to drink formula or need to eat a specific amount of dairy, but they do need the nutrients. Well, obviously, if you're not providing breast milk, then they do need a substitute. But I guess my point is that if your baby is nursing 4 or 5 times a day, you can offer water in a cup. You can offer yogurts, shredded cheese, other sources of calcium, iron, and protein to your baby. So even as your baby moves over the next 6 months or so, gradually in the United States, the recommendation is breast milk or iron fortified formula if there's not breast milk available as a substitute, and then cow's milk after a year. In Canada, the babies somehow are physiologically different, and they can have cow's milk at 10 months. Go figure. But my point is that the components and the nutrients of milk that the baby needs to get one way or another. So I would just, you can continue to offer the bottle at 8 months. She still has a desire and a need for suckling, but she may, if she's nursing a few times a day, maybe getting the need and the nutrition from that. And then you can offer water and very dilute juice if you choose to in the cup, as well as high quality solid foods. Okay, well, it is 1 o'clock, and I know that we all have to get back to work or back to our babies. And you guys, it looks like you've had a great chat going on here. I would love to hear some suggestions from you in terms of topics. I've got a range of topics on my mind that I'd like to do in the coming weeks. Introducing solid foods and feeding your breastfed baby. I'd like to talk about baby poop. So that will make Cindy laugh because she knows I love to talk about poop. But I'd like to talk about baby poop and how it can be normal for some breastfeeding babies to poop 3 times a day, and some breastfeeding babies to poop once every 3 days, and some breastfeeding babies that are really dramatic, they could just poop once a week. And it's not constipation, and we'll talk about all the different colors of poop, and what does this color mean, and what if it looks green and spinachy, and what if there's mucus in it. So that'll be a really fun week. Yeah. Okay, I better stop talking now. Cindy's going to get mad at me. Let's see. We have the skin webinar. Did you talk about that? So we just made a great webinar with the pediatricians from MD Moms, who have a nice high quality infant skincare line, and we're going to do a webinar with Dr. JJ at the end of this month. So that you'll come back to my breastfeeding chat next week, and please spread the word to any moms groups or websites that you post on regularly, because I'm here every week, and I would love it if I didn't feel like I was talking to myself or feel like I had to every week try to recruit moms to come in. So please help spread the word. Anything else? Cindy, am I forgetting anything? Okay. Gosh, I'm going to give shout outs because we have so many moms. I see a lot of our regulars here. Beth is here. Hi, Beth. And Deepa. And so you guys are probably too young to remember Romper Room, but at the end of Romper Room, the teacher would say, I see Alex and Beth and Bianca and Cindy. There's Deepa and Emily O and Hannah. Oh, there's Jamie and Jill and Kara and Kate and Lindsay and Imes. Mara, Marissa, Melissa. Sammy and Sandra and Sarah and Siobhan and Seema and Taryn and all the people that are lurking and didn't want to sign in. So thank you. Please do come back next week. Put the link. It's the same link. Put the link on your calendar so that you can click through at 10 minutes to 12 next week. Also, we record the chats now, so the same link to the breastfeeding chat page will have last week's chat link, which was using American Sign Language, ASL Sign, with breastfeeding babies, and then this one will appear there probably by later today or tomorrow morning, thanks to the amazing superpowers of Cindy. All right, that's it for me. Have a wonderful week, happy nurturing, and I hope to see you back next week.